Hi guys, my name's Brelyn Pence, and the ethical dilemma I've decided to do is ambiguous genitalia and gender assignment at birth. A little bit of background on the topic. So when someone's born with both male and female sexual characteristics, it's called ambiguous genitalia. And in today's society and past times, parents have felt the need to choose a gender for their child in order for them to grow up as quote-unquote normal as possible. So ambiguous genitalia occurs in about 1 in every 1,500 births. There are two sides to this controversy. The first is that sex assignment should be performed at birth, and the second is that sex assignment should not be performed at birth. Not performing the surgery will lead to mental health issues and a negative impact on the child's psychosocial experience growing up. However, on the other hand, the child has the right to make a decision for themselves, and more likely than not, recorrective surgery is performed later in life. So there are two stakeholders in this controversy. Obviously, the first stakeholder would be the children who are born with ambiguous genitalia, but also their family are stakeholders because they feel the pressure to make the right decision. So why is this topic important? Even though the population of people who are born with ambiguous genitalia is small, all patients should be treated equally and their cases should be ethically evaluated the same. Making a sex assignment decision has a lot of burdens on the healthcare system. If surgery is performed, supplies and medical teams are needed, initiating a time and financial burden. Ethically, hospitals have been debating if surgery should be performed, and we're finding that more and more hospitals are deferring surgery until later in the child's life. Costs associated with the controversy are dependent and based on healthcare coverage, and it's different for everyone, meaning some people will face a larger cost burden than others. In addition, large numbers of people are beginning to speak up more and more every day about their rights to their own body and ability to make a decision based on their own values and beliefs. With this ethical dilemma, all principles are involved. With the ethical principle autonomy, not performing sex assignment surgery and allowing the child to decide for themselves would obtain the child's right to make a conscious decision about their own health. With beneficence, we want to ask ourselves what will benefit the child most. And in order to do so, we have to weigh the outcome of mental health and child autonomy. With non-maleficence, not performing the surgery would take place to avoid complications and reassignment surgery later in life. With justice, we would perform the surgery based on tradition paradigm, meaning surgery has always been performed in the past. And with utility, performing the surgery could lead to excessive burdens for everyone involved, including hospital costs and patient financial burdens, as well as the emotional burden. With utility, it's really important that we're allowing the whole ambiguous genitalia community the same opportunity to decide for themselves. The most important ethical principle at conflict is autonomy. In this specific circumstance, it's important to obtain both parental autonomy and infant and child autonomy. Oftentimes, as mentioned before, parents feel the need to make the quote-unquote right decision. The pressure of the situation can lead to an impulsive decision. However, because the child is not capable of making an informed decision, technically parents do have the right to make a decision because they are the legal guardian. Infant and child autonomy is just as important as parental autonomy. The right to make decisions for themselves and validate their self-worth in healthcare decisions is an important factor to obtain. So for my paper, my thesis statement is, for babies born with ambiguous genitalia, gender assignment surgery performed soon after birth addresses the issue of gender assignment. However, the timing of the surgery should be postponed until the child can provide informed consent and participate in a meaningful way when making the decision. Laws, codes, and duties that are involved. According to the American Medical Association, parents obtain medical right to make decisions for their child. However, they also have the ethical duty to establish independent decision-making. The Supreme Court states, generally, when the physical or mental health of the child is not at stake, states and courts defer to the decisions of the parents. However, in this case, mental health and physical health of the child are at risk. Lastly, the First Amendment establishes the right to everyone, including children, the ability to make decisions for themselves. It's important to apply these codes when evaluating the ethical dilemma in order to provide justice to all of these cases. So, resolution of the controversy. In cases where children are born with ambiguous genitalia, sex assignment surgery should not be performed at birth. Instead, surgery should be delayed until informed consent is applicable to the case obtaining the child's autonomy. This allows for more options in the future for surgery, as well as a decrease in the numbers of recorrective surgery. Delaying surgery also improves chances of fertility in these children. Solutions for the future. When not performing sex assignment surgery at birth, it's inevitable that the children will struggle with psychosocial and mental health issues growing up. We need to be able to provide accessible mental health resources to everyone. We also need to minimize gender stereotypes. In today's society, there are male and female categories. However, introducing an other category, according to research, would help improve the quality of life of children living with ambiguous genitalia, giving them a sense of normal in society. Providing autonomy in all aspects of healthcare will obtain justice within the system as a whole. So we'll just recap on the presentation. So gender does not define someone in terms of characteristics in their personality. Providing a family with all possible solutions can decrease the amount of pressure they feel throughout the decision process, and it's important to encourage autonomy of both the parent and the infant. With the increase we see in today's society and hospitals deferring sex assignment surgery until later in life, when informed consent is possible, it's important that mental health resources are available, as well as minimizing gender stereotypes in order to achieve the highest quality of life for these children. These are the references used throughout the PowerPoint. Thank you guys for watching, and I hope that you enjoyed it.